Medicaid is being gutted, and if you're low income, working class, elderly, disabled, or a single parent, this could be devastating. Over 8 million Americans could lose coverage. Not hypothetically. This means no access to doctors, cancer treatment, mental health care, or even basic medicine. They're adding strict work requirements that punish people already working unstable jobs or caregiving without pay. One missed report, you're cut off. No coverage means more medical debt, more bankruptcies, and more people forced to choose between rent and staying alive. Rural hospitals will close. Entire communities will lose care. Children and seniors, the most vulnerable, will suffer the most. This isn't budget management. It's a direct attack on the people who need help the most. And while they slash your lifeline, the ultra-rich get another tax break. This is what happens when a government stops serving its people. Before we dive in, hit the like button so this video reaches many more Americans. Please consider subscribing and sharing to give us a nudge in the algorithm. We're doing our part to save this nation.
13.7 million people, 13.7 million Americans will be cut off from their health care and made completely uninsurable by the bill that Republicans are presenting today. You know, there's a lot that I've been hearing, and I've been listening to my Republican counterparts here today and what they've been saying about this bill. And the math is not adding up. They're trying to convince people that they are cutting millions of undocumented people from payroll, from Medicare, acting as though this is what's going to save it. Even if you believe everything that Republicans have said today, they are identifying 1 million, their claim, which I dispute, but if you believe them, their claim is that 1 million undocumented people are on Medicaid. So why are they trying to cut 13.7 million Americans off their health care? By the Republicans' own Energy and Commerce tweet this morning, their claim is 7.6 million people are somehow ineligible for health care. So why are they cutting 13.7 million Americans off their health care? They've asked us to read this bill, and we have. This bill bans the people that they kick off of Medicaid from even buying their own insurance from the Affordable Care Act exchange. So once you are kicked off Medicaid, you then can't even buy your own health insurance. It increases costs for people who they deem eligible and who are low income and forces them to pay even more. And if you have a private insurer, don't worry, you're getting screwed over too, because your healthcare premiums are going to skyrocket from the disaster that is happening from this bill. We've done assessments, because if you live in a rural community, you're gonna be hurt too. In New York 23, 25% of people are on Medicaid in this area of upstate New York. Westfield Memorial Hospital will be at risk of closure. UPMC Chautauqua is at risk of closure. Schuyler Hospital at risk of closure. California 23, where 46% of people are on Medicaid. Redlands Community Hospital at risk of closure if this passes. Victor Valley Global Medical Center, Loma Linda University Medical Center, all at risk of closure. Colorado 8, 24% of people in this community are on Medicaid, and Platte Valley Medical Center will be at risk of closure if these cuts pass. Who do you believe? The people who are trying to cut this, not, by the way, to cut from quote-unquote undeserving people to give to deserving people, but they are cutting these Medicaid care and these Medicaid dollars to pay for tax cuts for Elon Musk and billionaires. So this money isn't even going towards funding better care for people who are eligible. This money is going, and we are cutting money and healthcare from people and families who are suffering to pay for tax cuts for the rich. It is a crime happening in front of the American public right now. And I yield back.
Trump wanted more than anything was tax cuts. was to extend his tax cuts because they are set to expire on December 31st, 2025 of this year. And what he really wants to do is extend those tax cuts. But the problem with extending those tax cuts is that extending them is going to cost the United States about $406 trillion with a T dollars over the next 10 years. It's very difficult to add $4.6 trillion to the deficit and to the debt without, and still argue that you're gonna balance the budget. So one of the things that you keep seeing is promises that there are going to be these giant cuts that are somehow going to materialize. That Elon Musk and the Department of Government Efficiency, they said they were going to cut $2 trillion out of the federal budget, and they ended up at below 150 billion, and even that's not clear. It looks like they might have actually cost us money. So what are you going to do if you want to extend these tax cuts? How are you going to do this? So Ways and Means proposes to extend the tax cuts. So there's $4.6 trillion. And that's a problem because, among other things, by August, we are going to hit the debt ceiling, which is the amount of money that the United States can borrow. And, I keep always explaining the debt ceiling, and maybe you're sick of hearing about it, but just quickie. This comes from our past when the Congress used to actually have debates about how the United States would raise money. And in World War I, they were spending all their time saying, do we want bonds at 3% or bonds at 4%? And and so they just said to the Treasury, raise it however you want, but only to this much. And if you need more than that, come back to us and we'll decide if we should be cutting or if you should borrow more. And we're one of the few countries that does this. Congress still just appropriates money and then the Treasury is supposed to pay it. But if we're spending a lot more than we're taking in, the Treasury keeps hitting those limits that Congress sets. That's the debt ceiling. We're about to hit the debt ceiling in August. We actually already hit it in January, but there are things that the government can do to kind of nurse us along, doing things. It's called emergency. It's an emergency setting, and it's things like they don't fund pensions for however long it takes, and they have to make it up later, but we do have a little bit of wiggle room because of that. So we're expected to hit it in August. If we hit it in August, we'll have to default on our debt, which is just an economic disaster, although it's an economic disaster that a number of MAGA Republicans would like to have happen because they have no freaking clue how bad things are going to be if they do that. And I think you can see how little they understand about the economy if you look at how they were, cheering on, for example, all the cuts that the Department of Government Efficiency was making or the tariffs and so on. All right, so here's what we got. The Ways and Means Committee said we're going to extend the tax cuts, $4.6 trillion. And even though we scream bloody murder about how much money that the Democrats were spending, even though the deficit went down under Biden, we're going to raise the debt ceiling, $4 trillion. So now all of a sudden we are essentially paying for those tax cuts by borrowing, by saying you're allowed to borrow. But here's where it gets really interesting. That is being accompanied by cuts. And the cuts are all cuts to things that Americans need. So the Energy and Commerce Committee has proposed cuts to Medicaid. After everything Trump said about I'm not going to cut Medicaid and so on, they've proposed pretty significant cuts to Medicaid. And they are arguing that they're not really cutting Medicaid, they're helping Medicaid. But what they're doing, they say, is they're throwing off of Medicaid people who are getting it and shouldn't be, that you have to work in order to be on Medicaid. Which sounds great, except they're once again suggesting that people who are on Medicaid don't work. In fact, I pulled the numbers before I came on here. According to KFF, which is one of our most respected pollsters and medical who do medical stuff, say that 2/3 of the people who are on Medicaid are working. 3 in 10 of the people on Medicaid have caregiving responsibilities, are sick or disabled, or are in school. And that's why they would not be in the workforce. And that only about 8% of people on Medicaid are either retired or are unable to find work or are unable to find work. So what the committee has proposed is, of course, they're saying these are essentially, they're implying they're lazy people. But what they're essentially doing is making it so administratively difficult to get Medicaid that people are going to lose their Medicaid coverage. And estimates right now from the Congressional Budget Office, which is nonpartisan, are that I think it's about 13%, 13 million of the people who are on Medicaid will lose it over the next 10 years if the proposal goes through. That's a big if. So they want to cut that. They also want to cut all of the energy credits and so on under the Inflation Reduction Act of Biden's years, which were helping people to weatherize their homes and help them sort of conserve energy and fuel because it was cheaper. And they want to cut all of those along with some other things that were supposed to address climate change. And finally, they want to significantly cut the SNAP benefits, the Supplemental Nutrition Assistance Programs, in order to save money to cut money from the budget. So the overall picture here is that the Republican plan in the House of Representatives, and it's very bare bones, and this isn't even the other 8 committees that happened, are that they are trying to dramatically cut the services that Americans need and want. Medicaid is enormously popular. 97% of Americans support Medicaid. I don't think 97% of Americans support anything else, but they support Medicaid. And of course, that includes Republicans in high numbers as well. But they're planning to pay for those cuts for the tax cuts and so on, in part by slashing the things that the rest of us care about and that we need. And that's going to be really important to watch. And it's also worth remembering that this is not a done deal yet. These are the proposals coming out of these committees.
How cuts to healthcare and support services will impact you or somebody you know. So when you're diagnosed with cancer, chronic illness, or really any major disease, your income drops unless you're fortunate enough to have a wonderful retirement account. You work less or not at all while spending more time to just survive and learn to live with what you're dealing with. Meds, appointments, travel, rent, mortgages, groceries, it all adds up. And then what? You start depending on safety nets. Medicaid, Medicare, disability, research-based care, food pantries, state and nonprofit support, to name a few. But these lifelines are being cut. As you can see, the cuts are pretty drastic. And so here's what's on the chopping block. As we can see, NIH, it's a 40% budget cut, which will devastate cancer and chronic illness research and children's illness research. So it's slashing it all. FDA, we're facing a 17% funding slash, which will delay drug approvals and shift food inspections to the states. These are all sourced out, as you can see. Medicaid, up to $880 billion can be cut over the next decade. And I know my mom has that. How many parents or people that you know that are on Medicaid and depend on that to stay well or to stay alive? Medicare cuts, they're going to be hitting our Advantage plans with higher cost and fewer benefits, which, I mean, we need all the benefits we can get. Social Security Administration is slashing 7,000 jobs, which will cut down on your application process reviews, but also approvals. And it makes it harder to get to your offices with those shut down. So finally, this isn't policy, it's personal. And if you're lucky enough to be healthy today, I am so happy. But if you get sick, you're going to become low income too. These cuts are going to hit all of us.